Hey, it's Dr. J, and I'm here just to talk to you about healthcare credentials. We're going to do a quick comparison. We always talk about the ones that are known about the most when it comes to our profession. So let's talk about some of the other options because our skill set is very expansive. That means we can do lots of things. So let's talk about those certifications that kind of are an indicator to our employers that, hey, you do have these skills and you know your stuff. So, why do these credentials matter in not only health information management, but also in health information technology if you want to get out of just the data management part and get into IT? So, credentials, of course, set the standard in healthcare. And in health information management and technology, it is the validation of your expertise and your skills. You know, it is great. Of course, we have our foundation that we get from our programs. Then we have our credentials that also indicate, hey, not only did I earn this degree, not only did I get these skills while I was in the program, but I also have the certification that says, hey, I passed it because I know this information and I am competent and can do the work associated with it. It also supports patient safety and data integrity because these are important parts of every healthcare certification that you have. You got to know what it does and what it means to the patient. And you also got to know how important data is because every decision that we make in healthcare is based on data. From the time they walk in the door to the time they leave, and even once they get home, that data matters. And of course, it also shows your commitment to your professional growth because once you get a certification, you have to keep it and you have to do continuing education, stay abreast of what's going on in the industry in order for you to keep that certification. Credentials are your ticket to building trust, advancing your career, and shaping the future of healthcare. And that is what we are going to talk about. All of these credentials and what they mean to helping you be a part of shaping today and tomorrow. So first, of course, we're going to start with the RHIT versus the RHIA. Those are the two core HIM credentials. They're two academic credentials, which means that the way that you are able to take those is if you complete a accredited program, a KHIM accredited program. So let's try to get into talking about those. So first, we'll talk about the RHIT, the Registered Health Information Technician. It focuses on coding, data quality, and then technical HIM functions. And you know, our field is highly technical, so it does give you those basics, that core of what health information technology and management is about. Eligibility, you got to complete an associate degree in health information management, and you get that from a KHIM accredited school. Career pathways, you can be a coder, you can be a HIM tech, you can even be a data analyst. It just takes some time, some experience, some networking, and your credentials do matter. So let's just say that you do want to do your RHIA. Your RHIA, it focuses on everything that's in that core, but also on the leadership and informatics and the health information management portion. So it gives you those higher level skills. Eligibility, you do have to, at minimum, get a bachelor's degree in HIM. There are some alternative pathways, which I would be glad to talk to you about, but the core is bachelor's degree in HIM. You can do a master's in HIM, but of course, you got to get a bachelor's degree in something else first. And the same is with that post baccalaureate certificate, which means that you already had a bachelor's degree in something else, and then you're going back to get it. So think about that when you're looking at your bachelor's degree programs, and you're looking for RHIA eligibility. Career pathways, of course, it prepares you for those leadership roles, such as HM director and, of course, the informatics leader. So those are your two core. Your RHIT, you get that from completing your 2-year program, and then your RHIA, Registered Health Information Administrator, from your baccalaureate, your master's, or your post-baccalaureate certificate. So the key differences between the two. The RHIT, you learn a lot about that technical and the coding, those and that focus area of those specialties. Again, it's that core area. The RHIA, leadership and management. It teaches you the core, but it also gives you a little bit more in-depth insight into how you can work in these roles in a leadership and management capacity. And of course, the key difference is your degree requirement for the RHIT and the RHIA. So, after we think about the academic credentials, let's talk about advanced versus entry level IT credentials. You've got the CPHIMS and your CAHIMS that is offered through HIMSS, the Healthcare Information Management Systems Society. So let's get into those. So your CPHIMS is advanced. It focuses on leadership, systems, and project management. Eligibility, bachelor's degree, and experience. So if you ever wanted to get into a role such as a CIO, a director, senior project manager in a healthcare facility, or a vendor, or any other institution where they have health-related systems, that CPHIMS is definitely your ticket. It is the credential that they would look for. But there's also a great part. They do have an entry-level health IT credential, which is the CAHIMS, the Certified Associate in Health Information Management Systems. It's early career. If you want to get into system support and just the basics of health IT and informatics, this will be a great pathway for you. Eligibility, bachelor's or equivalent. Equivalent means that there are some additional pathways that you, if you have a 2-year degree, may be able to meet those requirements. It really takes you asking like your advisor, or even you can reach out to me and we could talk about how can I meet the equivalent pathway to be able to sit for my CAHIMS. And your roles there, analyst, system support, and coordinator. So you can start with the CAHIMS and then move up to the CPHIMS. Actually, that's what I did. I took my CAHIMS, worked for a few years, and then went back and took my CPHIMS, the Certified Professional in Healthcare Information Management Systems. And it really opened some doors when it came to working on the technology side of healthcare. So again, CPHIMS, advanced, degree plus 35 years, director, CIO. Your CAHIMS, entry level, degree, no experience required. Again, you can look at it. We can look at the pathways of how you can sit for that CAHIMS, work for a few years as an analyst or a support system, then get ready to take your CPHIMS to show that progression in your expertise in health information systems. So we talked about the RHIT and RHIA. We talked about CPHIMS and the CAHIMS through HIMSS. So now, let's look at some other things that we might not ever think about. What about the CSBI? It specializes in healthcare business intelligence and analytics. Just about every field, you're going to deal with analytics. You're going to deal with the data related to those subjects, whether it's healthcare, business. You even have analytics in fashion and food. This is the focus on healthcare analytics and reporting and business intelligence tools like Power BI. So the CSBI is offered through HFMA, which is the Healthcare Financial Management Association. It focuses on healthcare analytics and reporting, and it requires knowledge and experience in analytics, which sometimes you will be able to get that through your work experience, but you also can get that from the things that you learn in your program. Again, that's one thing that we could talk about. What is the pathway and what do I need to do to be able to take that? And guess what? I've got this certification too. And when I tell you that it was so valuable, when you look at how data helps to power decision making. Career pathways, you can work as a data consultant, data manager. You can even work with Power BI, because what it means is that you go in and you pull that data and you help your organization or your stakeholder make decisions based on that information that you pull. So yeah, CSBI, definitely. If you like numbers, you like data, CSBI is something you should look into. Data drives decisions, but a BI credential signals expertise in steering healthcare forward. So now we talked about all these, about HIM, health information systems, business intelligence. Now let's talk about revenue cycle. Revenue cycle is a huge part of it. And it's not just the coding. We're talking about the reimbursement and we're talking about patient access, which are two areas that we sometimes forget how important it is to have health information professionals in those spaces. So let's get into the CRCR, also offered by the HFMA, the Healthcare Financial Management Association. Focus, patient billing services, financial services, all of the things that are related to the money part of healthcare. Eligibility, high school diploma, and revenue cycle knowledge. So guess what? Even while you're doing your program, you have eligibility to sit for that exam. And the pathways, if you ever decide to stick with the revenue cycle side, you'll be able to work as a billing coordinator or revenue cycle rep. Lots of opportunities that those four letters will open up for you on the revenue cycle side. And then NAHAM offers the CHAA, which is Certified Healthcare Access Associate. Again, patient data starts from the time a person walks in that door to the time they leave. This certification focuses on patient access, registration, and front-end revenue cycle because the information that you gather that is attached to that patient encounter, it has so much to do with that revenue, making sure you got the right patient, making sure the right information is in the system to make sure that you can get paid on time. Eligibility, again, high school diploma and about a year of experience. This is a program that if you work in any aspect, whether it's a front desk clerk or a patient registration rep, you have eligibility to sit for this test. And some of the pathways, access rep, registration supervisor, access manager, especially if you pair this with your degree. So let's look at these two. So the CRCR and CHAA, both of them deal with very important parts of revenue cycle, but just from different focuses. The CRCR deals with the billing aspect, and then the CHAA deals with the access and registration. And the roles, CRCR is attached to that revenue specialist, and CHAA, patient access rep. This is why I say that it's so important for health information professionals to know where their skills can be applied outside of just the norm and what they think that they can do. You can do lots of different things in the healthcare organization because of your skill set and because of your networking and the relationships and because of these credentials and certifications. It's pretty cool, huh? So another thing, another area that we can think about is physician revenue cycle. So we can talk about patient access and revenue from the hospital side, but what about the physician side? Because physicians have to get paid too. So let's look at the CSPR, which is this highly specialized credential. It is a certified special in physician revenue cycle. And this is if you ever want to work as a physician practice manager or even in physician practice compliance. The eligibility is experience in physician revenue cycle. So if you've worked in billing or in coding or anything that deals with physician revenue, this is an opportunity. So let's just say that you have a CPC. You understand professional billing, this might be a great route for you to take. Or even if you haven't gotten your CPC already, but you're interested in it, that CPC paired with the CSPR means that you have a lot of experience and interest in being a physician practice manager or compliance specialist when it deals with the revenue surrounding physician services. So let's look at quality and compliance. So we talked about the CSPR and how it deals with physician compliance. Let's talk about quality. Quality is a huge part of healthcare. Again, in just about every respect, we talk about how important it is for patients to see the quality in what we provide. There are multiple credentials for quality, compliance, and auditing. So let's talk about them. First, you get your CPHQ, your Certified Professional in Healthcare Quality, offered by NAHQ. Focus, quality, patient safety, and performance improvement. Your eligibility, a bachelor's degree, plus 2 or 8 years in healthcare. Again, multiple pathways. And even if you have not yet completed your degree or you have an associate degree, there may be pathways. It's just something we have to sit down and look at and talk about. Then you've got your CHC. You've got your Certified in Healthcare Compliance offered by the HCCA. Focus, regulatory compliance, and risk management. Eligibility, you've got your bachelor's degree and compliance experience, something that you can take with you and you can work in just about every aspect of healthcare when it comes to compliance, because compliance is important to making sure that we get everything done on time and according to regulations and guidelines, and we stay above the law. That's important for us in healthcare. Then you've got your CPCO, your Certified Professional Compliance Officer, offered by AAPC. Focus is designing and overseeing compliance program. Honestly, this is one that I thought was like super interesting when I was doing this research. And it requires APC membership and knowledge of compliance. So if you're in your program and you say, hey, I think I really like this, whether you're in your 2-year program, your 4-year program, or beyond, that might be a great pathway for you to look into because it deals with not only program management for designing it, but also making sure that it works well. Then you get your CPMA, Certified Professional Medical Auditor, also offered by the APC. Your focus, medical auditing, documentation integrity. Your eligibility, again, APC membership, and then 2 years of auditing experience. So let's just say that you finish your program, you start working, you have your credentials in HI or HIM, even in coding. You work for 2 years, you really like the auditing experience, or you like coding and now you want to move into auditing. You work for a while, get that experience, take that CPMA. It'll open doors when it comes to auditing, which is a huge part of healthcare. Look at what AI is doing for healthcare, where the role of a coder is evolving to where we need people that can audit and validate the codes that AI chooses for our records. So auditing would be a great opportunity for you to work in healthcare. Healthcare quality and compliance credentials ensure safer, more effective care for every patient. It's not just the people that have access and touch those patients, but also the people that touch that patient data that makes such a difference when it comes to the quality and the effectiveness of the care that is provided. So let's talk about pathways and progressions, how these credentials support career growth. Why do these credentials matter to your career? Well, first, they facilitate promotions and new opportunities because in some places, they do look at those credentials along with your degree and your experience to see if you're ready to move up to a more advanced role with more responsibilities. It also supports specialization. So if you get into health information, you got your degree there, but what is your niche? Like, what is the area that you like the best? For me, it used to be health informatics. It still is health informatics, but I also love education. So it gave me opportunities through these specializations, these certifications that I have to be more specialized in those areas. And it also opens the door to leadership again. It lets your employer know that you are committed to promotions and committed to learning and continuing development of yourself professionally and personally. And it can move you into those leadership roles. So let's look at some potential career path examples. So let's just say you come in as a HIM tech with your RHIT and you could decide to go back to school, get your RHIA. It'll open up the door for you to be a manager or a director. Now, does this always mean that this is how it happens? Because no, we see some people that come out of school and they move into that manager role. But this is a pathway that's possible if you see that you start one place and you advance up the ladder. Then let's say you start as an analyst and then you want to go to a business intelligence lead. You may start out with your CAHIMs. You work for a while, you see what it is that you like, you love the data, you love the analytics. You move up, you get that CSBI. Now they know that business intelligence is your niche. So you can move into that role. Let's just say you started out as a building rep, but then you really like your revenue cycle functions. You become a revenue cycle manager. If you start out as a CRCR, or CHAA, dealing with either the billing or the access, you can move into being a leader in that physician office. And then, of course, compliance coordinator to an officer, compliance officer. Start with that CHC, CPO, CPCO, or the CPMA. You see that progression as you move up the ladder. And you know what? Some of these certifications, if you join as a member, those certifications are free. Get in touch with them. We can talk about which ones those are for. So choosing the right credential, factors to consider. So when you get ready to select your credential, think about your career goals. Do you like the technical aspect of your job? Do you want to be in leadership? Do you want to be an analyst? Do you like compliance? Figure out where you want to start and then where you want to go. And then look at the eligibility. What education do I have to have? What experience do I have to have? What membership do I have to have? And so that's what I was saying. Hey, there are some that you have to be a member to take a test. And then there are some others that if you're a member, one of the benefits is that any certification is free. I'd love to talk to you about that. And they all have student memberships. So that is always something to consider. And then again, what are the industry needs? Which credentials are in demand? Which are the credentials that people are looking for the most? And which ones align with what you want to do in your career? So let's summarize all this, and I'm going to share some resources with you and where you can learn more about these credentials. So here's our quick reference. I gave you the credential, what the major focus is of each one of these, the education levels. Again, some of these do have some variation, and there are some things that can be considered. If you'd like to talk about them, I'm definitely available. Just schedule some time with me. And then what are the typical roles that a person that gets those credentials can work in? And if you want to find out more information, here are some helpful links for you to go and look to see where your career might lead. The right credential is your passport to impact and advancement in healthcare's dynamic world. Thank you so much for your time. Have a good night.